If I push down on you hard now, see?
Yeah.
Now, hold that arm. Don't lose it. So soften your knees. More on the middle of your feet. More forward. You should feel forward. Your inner ear, you're so used to being backward bent, okay? Your inner ear thinks that's vertical, okay? So as soon as I bring you forward, okay, you should feel like you're more forward than where you used to be. But all I'm doing is bringing you vertical. You're usually back here, okay? So now, stay there. Put that foot back again. Yep. Put weight into it. Just relax it. Still weight 50-50. Now, hold that. Hold.
Yeah.
Now I'm having to push. Now, I can get you over, okay? But I shouldn't break you. I should push you off your feet.
Yeah.
Not break you in your spine.
Yeah. Okay.
Okay? So, just simply you getting in position of learning how to soften your knees a little bit, get weight on the middle of your feet, and try to get this pelvis, which leads the way on you, under you, and then relax with the head long.
There?
Yeah. Remember, soften your knees a little. Let your knees relax a little. There. Right there. Now stay there and just relax. You see how that looks?
Definitely.
See how that's different? Okay? It's going to feel really weird. It's not your normal. It's not your normal.
So, okay. I'm worried that it's going to be hard to really get the center. Should I?
It is going to be.
Is overcompensating
Yeah,
bad just to kind of train?
It's bad.
Bad?
Yeah, I'm going to give you some things that will help to make it easier. Because, look, the other piece to you is your hamstrings are pretty tight. Fortunately for you, in terms of your psoas, it's not that bad. I suspect your rectus femoris is a little tight. Let me see. Go face down for a second. Let me check that real quick. Yeah. It's symmetrical. What's tight on him is his rectus femoris, right? Runs from here to here, okay? His psoas is not too bad. Okay, but look. Watch what happens here. So that goes into his back pretty quickly. And this one's not as bad. If I stabilize him, I can get him up a little bit. This one has got a problem. See it going to his back right away?
Yeah.
Okay? So what that is he does not have enough length in the rectus femoris, so he doesn't have hip extension on that side.
Yeah.
So what he's going to do is he's going to compensate and get it from his spine and his SI on the left side.
Mm-hmm.
Okay, so, and if you look at him, okay, can eventually need a little more hip extension than he does, although he's kind of getting from his back. Anyway, just body position, okay, is part of the issue. Actually needs his talus mobilized. Let me see something.
Yeah, I do need my talus mobilized. That always gets stuck.
Yep. Have they ever manipulated it?
Yeah. I'm, almost 2 years out from the surgery, so for 6 months after, but at this point...
Look at the difference, watch. If I hold him neutral, there's his dorsiflexion on that side.
Yeah.
We come to here. That's it.
Yeah.
Then get past neutral. Gets to about neutral. That's part of why when he walks, he drops his knee into extension. And he goes from here to here, and he tries to transfer over the leg. He doesn't have ankle dorsiflexion to move over his foot.
Yeah.
So his knee juts out and goes sideways. Kind of does this, kind of locks the knee.
Yeah.
Like that.
Yeah.
And that's the side that he doesn't have the hip extension on. If you don't have ankle mobility, then a lot of times that leads to not having hip extension on the same side. Because every time you take a step, if you've got this movement, it keeps the ankle and half loose. He doesn't have that, so he does this and it drops here. Okay?
Yeah.
And he's stealing what he doesn't have from his hip extension from his back at this point.
Yeah.
So from a concept of what he needs to have done, I would have him working on things to try to get his rectus femoris to lengthen on the left-hand side.
Okay.
Doing any foam roller on your thighs, front of your leg? Okay, that part's good.
I've done a little, not too much in the leg.
Okay. Let me show you a couple things exercise-wise that I got with you. This will help you with the alignment piece. Put your back against the wall. So, bring your feet away. Now squat a little bit. Okay, so hold them here. Head should not be against the wall. It should just be just off. Okay? Relax your shoulders. Okay? And then practice this. So just tilt like that. Pause and release. So all this is a pelvic tilt, okay? But because you're upright against gravity, okay, this helps realign your spine to a degree. Now watch this. If you straighten your knees out completely, watch this. So did you feel that? Straighten out. Now try to tilt. So that's much harder?
Yeah.
Now watch, if we bring your feet back within 2 inches of the wall, now try to tilt. See how hard that is for you?
Yeah.
Okay. You want to get to where that's easy for you.
Okay.
Part of that is the tightness in the hips. Okay? And rectus firmness. A little bit of psoas.
Okay, so another thing too, because my therapist started really looking at the hips and working it, and I started stretching the hips a whole lot. My hips started hurting. And so she was like, well,
Get
back.
groin symptoms?
Oh my gosh, yeah. Right.
More from the left or right?
Right.
Okay. That makes sense to me. You know why? Because the same thing with this pelvis shear. Okay. Put your fingers in your hip. Okay. Put it in the groin. And I want you to do something. Okay. I want you to tell whether or not this becomes more prominent or less prominent. So now shift your pelvis forward. More or less prominent. Can you tell what I'm talking about?
No.
So what's happening is your pelvis sits on top. You have a femoral head.
Yeah.
Okay. As soon as you jut your pelvis forward, what that does is slides the femoral head forward. Okay. So this biases it towards sitting in the front. You know, put your fingers here. Now stick your rear out. And that becomes less prominent.
Yeah.
Or watch more prominent.
Yeah.
Okay. You're supposed to weight there on top of your hips. You sit right on top of your fingers. Not a model I showed you.
Yeah,
It's very
yeah.
easy to see.
Yeah.
But what your body position, you're getting a ton of extension in your spine. Your hips are in extension. That drives your femoral heads forward, okay, which creates a whole host of problems. And the other thing is your weight goes into your back.
Yeah.
Okay. What hip stretches were you doing?
Hip stretches. I was doing. I stopped this movie thing. I was doing these. That a lot. I guess kind of some of these. No, I know that's not real total hip, but
Yeah.
pushing out here, I could get the stretch.
Yeah, that's not what you need. That's not the direction. I'm sorry. I don't mean to tell you that. I just,
But that was more stuff kind of in my head.
it's the wrong direction. You've got lots of turn. You've got turn out. And you've got extension. You need this quadrant. This is what you don't get. Let me guess. That inches.
Not on this leg, this leg. But yeah, that.
And watch. Take it away. Yeah. You're getting a little bit of forward bias of your femoral heads. A big part of it has to do with your alignment in terms of how you stand, how you walk.
Yeah.
So let's try something. Stand up a second. Since you move, you can't just show them static. So go there and face that way. So don't change anything. Back up 30 pounds. Move for a second. So you didn't learn anything. Okay? You learned nothing. All right? Now just walk, and I want you to feel your body, okay? Walk for me. Correct me if I'm wrong, okay? I'm on back. But you have somewhat of a heavy heel strike.
Yeah.
Okay? You feel like you carry weight on your heels.
Yeah.
Okay? Go back again. And I'm not trying to lead you. I just don't have a lot of time to let you just explore. Okay, relax your arms. Let your arms go. Now, do you feel the heaviness in your low back when you walk? Come towards me again.
Sure.
Okay, go again. Watch the back. Don't put it on the hips on the right way. Okay?
Yeah.
Goes back into extension. Okay, so here's the beauty of it. It's no different. Stand and face that way. So face away from me. So soften your knees. Okay? Straighten out a little more. A little straighter. A little straighter. There. Now let's get your weight on the middle of your feet. So get your weight a little more forward. Hand on sternum. Easy way to do it. Just to look down. Okay? Notice the pelvis goes back and then stack the head back up. Good. Now relax your arms. So you should feel forward and relax your arms. Chin like that. There. Now let your back muscles go. Good. Now you see that alignment. That's what you're shooting for at home. You're going to be confused about that later.
Yeah.
And now walk for me. Walk. Just relax. Feel the difference in how you carry weight on your feet now?
Yeah, definitely.
And then the other piece is how heavy do you feel on your back?
Yeah, I mean,
Keep walking, go a normal pace, just easy. Back to the right. That's a soft. You shouldn't feel like you have a heavy heel strike. It should be whole foot.
yeah,
Okay?
I do feel more like, yeah.
You should feel like you're engaging your whole foot.
Yeah.
And you should not feel heavy on your back. You should feel like your weight's a little more forward.
Yeah.
Okay?
You feel forward.
And look at his back. You want to see the difference in, and I'm having to go back in a second. Look at the difference in muscle activity
In
and
his
what he
back.
sees with his spine when he goes back to old him. Okay, so feel that, okay, because you're going to need to feel it. Because when you feel like you're getting a heavy heel strike again, and you're starting to feel heavy here again, you're falling back to your old habits.
Yeah.
One of my favorite tricks with treating somebody is I will literally tape them where I want them. So every time when they start to fall back, it gives them a little tug.
Oh, yeah.
So there's lots of ways to get this to happen. But the other piece for him is going to be getting him to try to learn how to activate his lower abdominals, and there's some certain ways that we sort of do that, but I'll show him a couple ways really quick. Okay, now go back to old you. So you're stand wrong, lock your heels out, let the weight go. And Claudia, you come over here because I want you to look at his back muscles
Okay.
when he walks. Because I'm hoping you can pick it up. You may not be able to see it at all, but
think
now
so.
walk for me. See the hitch that happened in his back and the fold?
Yes.
That's what you don't want to see. Every time he takes a step, he's putting stress in his back. What's happened is the environment is such he hadn't been able to heal. He's young and healthy. He's
I
young and
know,
healthy. It's just he's got some postural habits and some other mechanical stuff that just, he's got enough things going on there that he can't heal.
He
He's
can't-
just staying agitated.
Yeah,
So let's
that's,
learn some things to help you. Right. Very nice. Okay, so this one, the pelvic tilt, against the wall, you want to get where you can do it with the heels just a couple inches off, and this be a piece of cake.
Yeah.
Okay, you pause it. That helps to do what we need to do. Okay.
How much should I do this today?
I'd spend at least 2 to 3 times a day for 2 to 3 minutes. You
Just
need
holding
repetition.
position?
Well, no, you tilt, and then you release it. You tilt for a few seconds, take a few breaths, because you tend to stay tense, and then relax. Okay? The other thing is I would be laying down on the foam roller, okay? So there's 2 things I would recommend for him, 3 things I would recommend for him with the foam roller. One would be having it perpendicular to his back, which is not turn away from me. Here, okay? Where he works on going up and down from the back here.
I do that a lot.
Right. The other is just literally lying on it lengthwise with your knees bent, towel under your head, okay? And then work on just relaxing into it, and then even maybe a little just pelvic tilt on it.
okay.
That's a good idea because that will help straighten this curve out. He's got to get a little bit loosened up of a curve.
Okay.
Now lie down on your your left side. Do not do this to the left, only do it to the right. Okay? Pull this up.
But I'm on the left. You said don't
Yeah.
take your left?
Well, you're going to do right rotation, so
Oh,
you have
okay.
to do it lying on your left. So in other words, you're not going to do it on the opposite side.
Okay.
So you should have a pillow under your head. Pull these up real high. You got to get this all the way up so that your low back is grounded.
Okay.
Okay. So you ever do like a regular standard pelvic tilt or a child's pose or any of those things like a quadrant where you're this? They ever show you this?
Yeah, sometimes I've done that.
Because that's a nice one for gently getting some flexion
Yeah.
in your back. Okay, well anyway, you should have a pillow. Okay, it would be here, your head's on a pillow. Your knees, so you got to get him as high as you can. Because he needs to have his lumbar spine flexed.
Okay.
Put this hand behind your head. Okay, right at the base of your neck. Okay. And what you're going to do, we're going to imagine you're on a pillow. You're going to turn your head to the right, like this. Okay? And what you're trying to do is turn your rib cage this way.
Yeah.
Okay? Trying to get this piece on the ground, but you don't do it with your arm, you do it with your trunk of your head. So in other words, watch me. Watch this. You're here, okay? You're turning like this, and then you breathe. You just tendencies to be tense, okay? Just working on right rotation. You see how high I've got my knees?
Yeah.
This has to be up really high, and your lumbar spine has to be flexed. If they drift and you're falling into extension, you're going to make it worse. Okay? So try it again. Do not do it lying on your right rotating arm. This arm is relaxed. This one's not relaxed. So you're just turning your body. And what you're really trying to do is turn your rib cage.
Okay.
Okay, elbow stays close to your head. Okay?
Okay.
Nice. So that's just trunk rotation. I would do the thoracic work with the foam roller first. I'd also roll your glutes. Work on rolling your glutes out a little bit on the foam. Like I've done that already.
Yeah.
Yes. Okay. And hamstrings. Glutes and hamstrings. So glutes, hamstrings on the foam roller, perpendicular, rolling from here to here, and then just lying on it.
How do you get a good roll with hamstrings? I don't feel like I get enough pressure on it.
It's harder. It's hard. It's hard.